Hi there, and welcome back to another edition of our COVID-19 update with Dr. Manfred Green, Director of the University of Haifa's International Master's Program in Public Health and Global Health Leadership, hosted, of course, by the American Society of the University of Haifa. So let's dive in as we've got a lot to uncover this week. Blighted by one of the highest levels of coronavirus infection, with new infections running as high as 4,000 a day. Israel announced yesterday it will be entering a 3-week lockdown from Friday ahead of the Jewish holidays. Under these restrictions, Israelis will be limited from traveling more than 500 meters from their home, except for essential needs like food and medicine. Schools will be closed starting Friday, and businesses and public sector employers will face strict limitations. So, Dr. Green, first off, welcome back. Can you please give us your thoughts on these new lockdown measures, why they're being introduced now, and whether you feel as though they're necessary?
Okay, again, we have to look at the overall picture and what are we talking about? We're talking about a virus that spreads very easily. It can cause very severe disease, but in most people, it causes a mild disease. So we have to remember that a large percentage of the population who get infected don't experience a major problem. And so it shouldn't be frightening in that respect, but there is a small but significant section of the population who get severe disease. And of course, there is some mortality. People are dying. So it's obviously a serious disease, and it's a very easily spread disease. I think the two things going together are that there's no vaccine at the moment. The large parts of the population are not immune, and it spreads very easily. And as you say, so let's now look at this whole issue of lockdown. I don't know if you remember that, as I said, maybe in a couple of sessions before, that what we have to promise the public, basically, is that we're going to have to try and get back to living what we would call the new normal, a normal situation with some of the restrictions, but the public has to be reassured that they can get very good treatment if they become ill. And so, in other words, you know that if in fact you do become ill and you need specialized treatment, you'll get. So here we come to the question of whether in fact there is a possibility that the health services will be overloaded, and therefore the people who become ill will not be able to get the right treatment. And this is a question, I don't think that, as I understand it now, from what I've heard from them and the numbers that we have, let's say we have 500 people who are seriously ill, what we would call serious condition, and or maybe some on respirators. That shouldn't be something that would overload the Israeli health system, because we have the capacity to do that. We have reserve capacity in the sense of an emergency by opening up much more. There are hospitals that have emergency centers where you can open up very many more beds and so on. One of the problems is the staffing problem. And here, I think that I would already say that the country, the government, has to look very seriously at how they've funded the health system, because we shouldn't be in a situation at the moment where, in fact, on this, at the level of what we're seeing of disease, and even with the potential of being much more, that should not threaten the health system. That's something that needs to be remedied. And this, if anyone puts up this red flag or red light that they said the hospital directors did, that's the red flag. Underfunding of the hospitals, underfunding of the medical system, not enough doctors, not enough nurses, not enough beds and not enough reserve capacity to cope with emergency situations. And that has to be dealt with now, not to wait till later. That has to be now. And I'll make my last there, and I'll come back to it. I believe that right now we should be investing in maybe what would sound like dramatic projects. I mean, maybe we should be building 3 new hospitals, specifically for infectious diseases. One in the north, one in the center, one in the south. We can do it in the center in an existing hospital, which is Golda, just expand it, do that in the center, and make these infectious disease hospitals, particularly for these emergencies. I know this is a kind of what you would call an offbeat and not the mainstream thinking, but I would like to think that this is something that should be considered.
Yeah, absolutely. And you alluded to something there by insinuating that we shouldn't be in this position where hospitals are overloaded. But I mean, there has been much talk over the past week, and a lot of put this lockdown decision down to the fact that the government was forced to take such action, because we have heard from hospitals over the past week about how overloaded and bursting at the seams they are. Is that not the case? And is that maybe an overestimation of how bad things are right now?
In terms of actual beds of availability for corona patients, overall, it's not overloaded as I understand. Again, I'm not talking on the basis of figures I see. I'm understanding this from what I hear from the heads of the hospital. There is some overloading in the north because they've experienced more in the recent time. And so there may be it may be necessary to move patients from one center to the other. But I think, again, I would ask the question, I'm not sure that I can give the answer, why we are not actually using what we would call emergency regulations and do much more to expand that capacity. For example, in recruit medical students, 5th and 6th year medical students, and get them into the wards to help in the management of patients. My understanding is, I know they say you need specialized care for the patients, which is true. But if you look at a typical department, you would have a couple of very highly specialized people, physicians, usually the senior people, and then the more junior people doing the day-to-day thing. I think that most of the more junior people can fairly rapidly be trained to do the day-to-day care of these patients with the support of the specialists. Now, I know I'm going a little bit outside my field in the sense that I'm not a clinician. I'm a physician, but I haven't worked in a hospital for many years. But what I'm saying is I think we need to think in terms of expanding that capacity, because we have to be ready for emergency situations. This is not a situation that should be looked at as well as this, it happened by surprise and therefore we're not ready. We need to be ready for surprises. So I think the first question to be asked is, why is this claim being made that we're being overloaded? And the second thing is, okay, let's get into this and overcome this by using emergency conditions, so to speak, and recruiting staff, new staff, people, some people have said pensioners, people who've recently gone on pension, but expand that capacity and make sure that we can actually give everybody good care. That brings us back to the lockdown, because the lockdown is done in response. The lockdown is costing an enormous amount to the country. Yep. People are talking about, I don't know what it is, $1 billion every week, or $2 billion if you talk in terms of that. Whatever it is, it's very large sums of money. That amount of money could be put into the health system. If we could have avoided this situation of lockdown, put that into the health system, not only do we solve the problem, but we also put infrastructure in for the future. So why not think in terms of now, let's put the money in now and prevent, so that the next lockdown we don't need to have, and we'll save that money and use it now. But of course, it needs thinking of moving resources from one area to another.
Yeah, sounds logical. So I'm going to backtrack a little bit and ask you, how do we get to this stage? By that, where did the country go wrong? And from a public health perspective, what do you think is responsible for these crazy spikes in statistics?
I think there was not sufficient enforcement of the regulation. The main regulations, in my opinion, in this kind of situation is to enforce the regulation that says that you cannot have large gatherings. If somebody or people insist on going ahead with large gatherings, these people should be charged with criminal offenses, and they should be taken to court. The actual institutions or the reception halls or the centers that host these receptions should have their licenses cancelled. Basically, if a reception center, if one of these halls that are used for weddings or whatever has a license, they have a license because they are considered to be safe. And there are all kinds of safety regulations concerning the structure of the building and the amount of entrances and fire regulations and so on. This is a violation of a safety regulation. And once this is a violation, this is threatening human life. And that it's threatening human life means that they should be charged with a criminal offense, and that institution should be closed. That should be closed, their license should be taken away. And that's my feeling now, so that if you can prevent these large gatherings, very sad. If you can make sure that people are wearing masks in closed spaces, and I mention that because I think people have to differentiate. I know people saying, make it a blanket thing. I think, first of all, we have to say, if you're in a closed space and in a public space, wear a mask all the time, on the nose and the mouth, and don't take it off. If you're outside, I'm not going to start chasing you in the street because you don't have a mask on, because I'm not convinced that that is a real danger to the public, but certainly in closed spaces it is. So once the public can distinguish between this and not feel that actually they do something actually ridiculous. I've seen this happening. People walking with a mask on in the street, and when they go into the supermarket, they take it off because they want to talk to someone or they want to talk on their phone. So where they should have the mask on, they don't, and where they're not necessary or so essential, they put it on. I've seen this, by the way, in meetings, and by the way, I've seen it even in the ministries, where people sitting in a group in a room, everybody's got their mask on, which is great. And every time someone speaks, he takes his mask off. Well, it should be exactly the opposite. Let everybody sit there with their masks off, and only the person speaking put the mask on. That's right. I mean, that's the aim of it. So basically, I think the message should be masks, no large gatherings, or limited very much, and maintaining distance. As you know, currently in Copenhagen, and if you go to a supermarket here, people stand apart. I mean, there's no way that you have two people crowding you. People back away. If you move close to someone, they move away from you. So I mean, it's very, very careful. It's a part of the culture almost here. Yeah. I'm not saying there's not a problem, because there is an increase in cases in Denmark at the moment, but at the moment it's still at a relatively low level. What I'm saying is that has to become part of our culture, and that is the new normal. Not to crowd each other, to try and, masks in closed places is probably a good idea most of the time, and avoiding these large gatherings until, at some stage, we can find a solution. But this is going to be with us for a long time. Even if the vaccine comes, that's the last, even if the vaccine comes available in December, January, February, so that vaccine is not going to be given, not everybody's going to want it. And maybe this will give me an opportunity to talk about some studies we do.
Right. And speaking about vaccines, which you just mentioned there, what are we hearing regarding a highly anticipated vaccine? Are there any clinical trials you've read about that seem like they may be on the right track? And specifically, what is Israel doing to be part of the solution to finding a vaccine?
We've spoken this before, that it actually takes a long time to develop a vaccine, usually many years. And I can tell you, as someone who's been involved in testing new vaccines and vaccine trials, that you get excited very often, but just as often, if not more, you become disappointed. It's a long and very bumpy road. What probably is happening now is, first of all, there are many new technologies. It's better technologies now. I'm hoping that these new technologies are going to make things, speed everything up. We're going to get vaccines out much quicker and better vaccines. I balance this with saying that I've been optimistic with vaccines before and been very disappointed. Just to give you one example, I've been working in a program, a Shigella vaccine, a vaccine against dysentery, diarrhea. Well, that program, I'm now not so much involved in that program. I came into that program more than 20 years ago, when the vaccines were already coming into the pipeline. There's still no vaccine. Right. So this is like 20, 30 years. So, and now we're very excited because there may be a new Shigella vaccine. So, but that's 30 years. Okay, so some of them will take 5, 10 years. So we're hoping that now the new technologies will bring us much closer. But there are a lot of questions that have to be asked about it. I would say that if you're talking about the future, it'll be a combination of a vaccine. We'll have to continue some kind of masking and so on in closed spaces, and some kind of social distancing, at least for, I would say for a couple of years possibly. Living a pretty normal life, but doing things that are, you know, a little bit uncomfortable, but not really that severe. But we'll get to the stage where I think we'll have this kind of combination, and then we'll be talking about how we can at least aim for eliminating the virus, if possible, which is obviously a optimistic aim, but it's an aim that we can set ourselves. But that'll be a combination of factors. It won't just be the vaccine, and it won't just be social distancing. It'll be a combination.
Right. So you've spoken about developing the vaccine. I guess the next stage is, once you've got the vaccine, is people actually taking the vaccine. According to a recent poll, some 20% of Israelis said that they would not take a vaccine when it becomes available. What does Israeli leadership need to do in order to gain public trust so that individuals are incentivized to take this vaccine?
Okay, so we've actually received a small research grant from the Ministry of Science. And so we're doing some studies on this. Excuse me. So the study now, we've just done one survey and we're in the process now of doing another. And we've looked at the response of the public in terms of how they actually view vaccine. And it's actually an interesting combination. Pretty large percentage, or shall I say a relatively small percentage of people say they would take the vaccine when it is first offered. So in other words, if you take the 20 or 25%, these are the people who say, once the vaccine available, I'll take it.
Right.
Still, the majority said that they would not take it if they are the first to be vaccinated.
Yeah.
In other words, if the vaccine arrives here in January, they say, okay, everybody come and get vaccinated. You're probably not going to have to, you probably have to kind of be in a situation where you have to persuade a lot of the people to get vaccinated, because it's probably going to be a smaller proportion that will say, okay, I'll go for it. Another proportion, maybe 20 or 30%, said after it's been in process, you know, again, they say how long? They probably want to wait 6 months or a year until it's okay. And then, you know, the rest will come in later on. So you're right, it's going to be a process. I wouldn't be surprised at all if people will actually wait and not want to be vaccinated until they see what happens in the large vaccine campaign. I might want to just mention one thing just out of a curiosity. In 2009, in the influenza pandemic, there was a new vaccine brought out for that specific strain. And in the early stages, you could get the routine influenza vaccine, which did not contain that strain, and the other one separately. So there were two vaccines. In other words, you got one shot which had 3 of the other strain, and the one shot had the new one. Many people were choosing only the older one, which didn't really give you much protection at all, and were refusing the new one, which was actually aiming at the actual virus that was going around. So you could hear about this. It doesn't sound logical, but they said, no, it's a new vaccine. We want to wait and see.
Yeah. Well, first of all, thank you for sharing the latest research of your own studies. I know that that's actually fresh findings that you've just accumulated yourself.
Yeah, I've just got the output from the computer, basically. So we haven't really put it together. Next time we meet, I'll give you some much more organized stuff.
Excellent. Well, next, I want to go a little closer to home. How does the lockdown affect University of Haifa's planned full semester start date on October 18th? And what is being done to try and keep the numbers on campus at bay once classes do start? And I guess, what is your suggestion as well with regards to universities starting up?
Well, again, I'm going to probably say a few things about what I think should be done, which includes using resources and funding. And universities are always underfunded, right? We never have enough money. So I think, though, that this is a time where there's going to have to be talk about reorganizing the way things are taught on the campus. First of all, there's going to have to be a much more emphasis placed on having much more wider seating space for students, which means changing the whole structure of the lecture theaters and maybe giving lectures in several lecture theaters at the same time. So this is obviously a huge challenge for a university which doesn't usually have an excess of space for lectures. But that's something we need to do. We'll have to think in terms of spacing, maybe having sessions in the morning, in the afternoon and evening, and then having students only coming at certain times. So these are the kind of so-called hybrid things. In this first semester, I think that we're probably going to be forced into a situation where a lot of it is going to be given online. And we'll have to be very, I would say, creative with the online and make it as much of a personal experience as possible. So it's not just going to be online where somebody, you come on, you don't see the lecturer. It will be an interaction with the lecturer like we're doing now, but obviously it's not going to be sitting in the same room together. And then there'll be other options, maybe where there'll be the so-called hybrid teaching, where there will be days in the week where, say, some students will come on one day and some students will come on the other day, so that we keep the campus at a much lower level. So these are the options that are probably going to take place, or at least are going to be considered for now. It's going to make things complicated. One option which appeals to me, and I'm not saying this is going to be adopted by the University of Haifa, but this is something that appeals to me, is actually to do a lot, if not most, online, but have meetings with the students, let's say once a week. So in other words, have selected informal meetings with them. So you say, okay, your lectures are going to be online, but once a week we'll be bringing in students for informal discussions so that we can meet the student. And that'll have to be done in small groups. This is what we are planning for our international program. So for our international program, which is a small program, we will, whatever happens, we'll teach online, whatever we have to do, but we will be bringing them in to meet with them personally in small groups. And that's, I hope, whatever happens. By the way, our first event for the international program is to go on a picnic together. So we will be going outdoors, we'll be walking in the park next to Haifa University and enjoying each other, but outside, which I think is also a good idea.
Right. And a lovely view from up on top of Mount Carmel as well, which helps.
Right.
Wonderful. Well, it looks like we've run out of time again. I feel like we could talk on and on about this topic with yourself, Dr. Green. But thank you so much again for speaking to us at this crucial time and helping us digest what Israel's impending lockdown means for us all. As always, if you do have any questions for Dr. Green, please do leave them in the comments section of this video or email them to info@asuh.org. As always, for more information on the university's work around the pandemic and to support the university during this time, please find a link included in this post. Thank you all for tuning in, and please stay safe.
Thank you very much.